to just get in there and give it a go. There is training around. There's groups that you can join to provide that networking and support, and to have the confidence to ask questions when you don't understand. That's the biggest benefit you can provide is just asking those questions, having the confidence to ask the questions.
The one piece of advice that I'd give to anybody who is a consumer rep or aspiring to be a consumer rep is you have to have a deep commitment to system improvement. You have to be there for all the right reasons. And you also have to share that goodwill with the staff. We have to understand that when we come into these spaces, and it's hard as a consumer rep and it's hard as a staff member who is unfamiliar with dealing with consumer reps. We have to have a sensitivity to each other, and we have to have a committed collaborativeness to want to make the system better. We can't move mountains quickly. So we have to pace ourselves, and we have to be prepared to be patient. Changing the health system cannot and shouldn't be transformational. It needs to be incremental, and that's how we keep our patients safe. But also, having said that, we should be prepared to commit to the incremental change.
It's all about communication, but even more so, it's about listening. And I've just done a paper on cognitive bias. And in Australia at the moment, 1 in 7 patients has an adverse event. And the proof is that 77% of those mistakes can be linked back to cognitive bias. And cognitive bias is about recognizing the patient where they're at and not making a judgment about them. And so I think that for consumer reps, being able to send that message that what's really needed is listening, effective and authentic listening to patients, so that they're able to give a message of what's wrong with them. That was particularly, if I can diverge, particularly what happened to me with Addison's disease. I was sick for 18 months. Nobody would listen to what I had to say. They all gave me Valium and antidepressants and nothing worked. And I was actually dying, but nobody was hearing what I said. So that's become a big soapbox for me, is that we need to get the medical profession to understand that we know what's going on inside our body. We just need to be listened to so we can get our message across.
It's a question of longevity. It's a question of consistency. It's a question of always being willing to learn and always having an aptitude to how you exercise your authority, your tenacity, whatever you want to call it, but ultimately it's influence. And what I find is that if you exercise it quietly, with a degree of subtlety, with a degree of let's find something that you want, that I want, that we can both live with, which is sort of the compromise position, you will get a lot further and you will actually begin to get things done. It comes back to the question of patience.
That your passion of lived experience, that is inexhaustible fuel, and it is never going to die. And that is a wonderful, wonderful thing. It may not be seen as a wonderful thing by the system, but it is a wonderful thing. And whilst you've got that endless desire for positive change, it's important to understand that sometimes you can step out of the dance. You don't need to leave the dance altogether, but there are ways you can step out of the dance and step back in. Always be okay to say, I need a break, because this work can be really challenging. There have been some times where I've stepped right out of the dance and thought, darn it, I should have maybe kept that dance going. You know, this is what they call a forever game. We are playing the forever game of health reform, and the players will change, but the game will go on. So it's really about how can I be part of this game? How can I make this game better? And how can I look after myself? So allow myself to come in and out of the dance as needed.